A lot of good questions. These are questions I think that general people have. I mean, these are common problems that essentially everybody sees at some point.
I really just wanted to talk about the orgasms. That's why I had him here in the first place. That was my main goal. How's it going, Blamers? Welcome to Blame It on Mel. Today we have a very special guest, my favorite doctor, Dr. Craig Flinders. Don't tell my neighbor down the street, though, because he might think that he's my favorite doctor. So we'll keep that between us. But Craig, let's start off by just telling people what kind of a doctor you are.
Yeah, so my background as far as training goes, I did my undergrad at University of Utah and Texas Tech. I went to medical school, Texas Tech. I did an internship in general surgery, and then a residency in anesthesiology and a fellowship in pain medicine. And then about 15 years ago, I became very interested in wellness medicine. And so I've had a wellness practice also for about 12 years.
It's amazing.
And so I do both interventional pain medicine and a wellness clinic.
So what inspired you to branch into this wellness area?
This was just an area of interest, really personally at first. And then, later I kind of, really saw the magnitude of the problem that was underserved.
I call it your side hustle, even though you don't even need a side hustle.
Yeah, it's kind of the monster that I created.
You think it's a monster?
Well, I mean, in a good way. I really enjoy, my wellness practice, and it's good.
What is most understood about the wellness field?
Unfortunately, if you look at treatment algorithms in medicine, they don't necessarily follow best science. They actually follow economics more than anything. And it's unfortunate, but true. If you look at the driving force behind a lot of the things, that's the way it goes. I think everybody saw it during COVID. Look what happened.
What are you referring to?
It was very obvious what was driving the overall agenda. Certainly in retrospect, people see it. And unfortunately, wellness is the same way. If you look at the United States, you can, I think, easily argue we have the most advanced medicine anywhere in the world, but it certainly doesn't reflect on our society.
Why do you think that is?
Because of what we concentrate on in medicine.
Which is money.
Yeah, we concentrate on areas of medicine that may have negative impact on our quality of life and longevity. We have almost third world countries that live as long as we do.
Is that because of what's in our food, do you think, or is it primarily because of the medicine?
Oh, it's a combination of a lot of things. We have a lot of very unhealthy things in our lifestyle, definitely in our foods. Look at the food pyramid. It was upside down for 30 years. And it's hard to walk that back.
When patients come to you on the wellness side, what is one of the top things that they're looking for when they come to you?
Whatever it is. It's like low energy or fatigue or anxiety or a combination of a lot of things. And I actually see more women than men to begin with. Oh, yeah, for sure, more women.
Because you saw my husband before you saw me.
Mm-hmm, which is unusual.
Mm-hmm.
Usually it's the other way around. Patients talk, and particularly women. Women are much more open about those sort of things than men.
I don't necessarily know if that is true, because I know that I talk to a lot of the husbands that are patients of yours, and the wives will not admit it. They will not admit that they come to you.
That's funny.
They're gatekeeping. They don't, because I look at it, I always say I'm on the Flinders cheat code. Like, really, or I'm on the Flinders cocktail. I say that. And a lot of people will not admit that they go to you. And I think it's because we all, a lot of us want a leg up, but they don't want to share and tell everybody else about it, because we feel good. We're starting to not just feel good, but we're starting to look good. because I didn't look like this before I saw you. Like, I didn't look terrible, but I definitely look a lot better than I did. I have more muscle on me. I weigh the same, but I have more muscle and I'm more lean. I'm more toned. And I have more energy.
It becomes really pretty obvious, particularly in women as they get a little older. But the physiology in women drastically change. It compares to men as we get older. What I'm speaking about is women go through menopause, and men, despite
I have not been through menopause
no, you're
yet.
not.
Let's be clear.
No, absolutely. But I mean, even through the early 40s or late 30s, it can be very, very different. And you hear a woman, it's like suddenly whatever happened, and after their last child or whatever, they say,
Yes.
I just don't feel right.
You had mentioned
I
that
have
to
low
me
energy.
too, is that the more times that you've been pregnant, the more kids that you have, also that can throw a lot of your hormones and things out of balance.
Yeah, there's a lot of things that happen that we don't understand for, a specific reason. But if you listen to a woman's story, they tell you, I don't know, but after, my whatever child, I haven't felt right. They have anxiety issues. They have, insomnia, fatigue. They just don't feel well. And typically in medicine, we don't have, you're not taught things like that in medical school or residency. We're not. We learn very little about the management of manipulating the inherent hormones of the body. We're not taught that. And I think
Why?
I think why that is because it goes back to economics. There's no money in hormones.
Why?
Pharmaceutical companies can make them, right?
Okay.
But anything that's bioidentical to the human body, they can't patent. No patent means no money. No money means no interest. And so hence that's what happens. So now we're giving hormones that are not natural to the human body to women to try to, manipulate their health. Look at the size of the American person now as compared to, say, in the 70s. I mean, just look at pictures from the 1970s at the beach and look at them now. Drastically different.
Why do you think it's
You got the
so
average
different
weight of
now?
a woman going from 135 to 175 now. It's very different. Well, a lot of that has to do with our diet and lifestyle.
Diet.
Yeah.
What do you check for that normally gets overlooked?
So we look at, thyroid hormone is a very powerful driver of well-being. There's like 200 different symptoms associated with low thyroid, and there's a lot of symptoms that overlap between low thyroid and high thyroid. And if you look at the ranges of hormones, they're huge. It's a huge range, and you could be anywhere in that range, and typically we go, oh yeah, you're normal. But just realize if we move you from one extreme to the other, you may feel very different. And typically in medicine, we don't try to make you feel good or be healthy. We treat disease. And so thinking within the realm of what's normal and abnormal, there can be a huge difference. Another thing is looking at insulin. Insulin is a very, very powerful hormone, and it drives so many things. And typically in medicine, we don't look at it. We look at glucose. We're a glucose-centric, society, if you will.
Insulin is a hormone?
Yes.
I had no idea.
Very powerful, and it's
Is that
insulin.
a common thing most people know?
No.
No.
They don't. They don't realize that it's insulin. The insulin levels is what determines what the body does with energy. It's the switch for switching from making fat cells to burning fat cells.
So are the normal ranges that doctors look at nowadays, are they the same as they were decades ago?
Look at testosterone level in men. Those levels are drastically changing. They're going down.
The normal range
No,
of what you would consider normal.
Well, what we consider normal. But instead of us in medicine realizing that, hey, we've got a problem, our men are losing their testosterone levels. But what drives, why would we suddenly say, oh, what was normal in the 1970s is not normal anymore?
Right.
Now our levels are drastically changing. Look at sperm count from men from the 1970s compared to now. We barely make 50% of that. We can't say that that's healthy for human society. That's a problem.
And what sort of effects is low testosterone in male and females?
Well, if you lower testosterone levels in men, then things change. I mean, it's what makes up male behavior. You know, it affects percent body fat, the way we feel, our sleeping. It affects our mood. There's so many parameters that it affects. I mean, it's extremely powerful.
Why do you think that men's testosterone levels are going down?
It's definitely a multifactorial problem. Has to do with foods, lifestyle. Certainly, there's chemicals that we're exposed to in our environment, all of which can negatively affect us. But the levels in general are going down. The highest levels I ever measure are never in young men. The highest levels I've ever measured, actually the highest was in a 57-year-old man. The next was a 62-year-old man. I've never measured a good high level in a young man.
Why?
Well,
Why is that?
maybe it's somewhat selective. It's not like I'm measuring all across the board. Typically, people are seeing me for a problem.
Because you're able to help adjust their testosterone level.
Oh yeah, there's a lot of things we can do to help that.
What? Such as what?
Even changing diet and exercise can make a big difference, particularly in a young man. As men get older, then we lose, our ability to maybe make quite as much as we used to.
So what types of diet and exercise are you recommending to adjust that?
We look at their insulin resistance, and we want to put them on a diet that tends them towards much lower insulin resistance. Combine that with exercise, and definitely can be helpful.
Because you told me that what I was doing was backwards, and you had me switch my exercise. I thought I was doing really well, and you had me switch it, and I started to notice drastic results, and to the point where I don't even have to work out as much or as long as I used to.
That's right. I mean, you want to exercise in an efficient manner, so that your time is well spent. You're getting a lot of bang for your buck. And so a combination of resistance exercise, weight training, alternating with, a good cardio workout, particularly, HIIT exercises. So you want to minimize stress on the joints, but maximize your gain with regards to exercising into the anaerobic zone of exercise. There's a lot to be gained with that. And you can do that, within 20 or 30 minutes.
I was running for 45 minutes a day, and then I would lift maybe for 20 minutes. And you had told me that was really bad for my joints. I was going to destroy my knees as well.
High impact exercise over time can be hard on the joints to some degree, much more so than, exercising in a different way.
And I now run 10 minutes just to get my heart rate up, and now I lift for 30. And I have completely changed the way that I look.
Yeah, I mean, it does amazing things for the woman's body, I mean, if you look at women over time, as they age, they tend to lose muscle mass and bone density and gain percent body fat.
So we talk a lot about testosterone in men and why that's important. And because when my husband came to you, I think you even made a joke about something about how if he had a vagina or if he was lactating, it was something like that, which I remember him coming home and being like, this is my favorite doctor. I mean, he basically told me.
I can't imagine I would say something like that.
Yeah, it doesn't sound professional at all. But why do we always talk about how important it is in men and not so much how important it is in women?
It's interesting. It's really, you don't hear much about looking at testosterone in women. It's just not mainstream, I think, as far as medicine goes to look at it. But making a woman later in life a bit super physiologic with regards to testosterone does amazing things. We don't have to have levels like a man, but giving them some or optimizing it can really make a difference, particularly in holding muscle mass, bone density, their general well-being. It's definitely a feel-good hormone. And, we have a lot of evidence that reducing the risk of breast cancer, it's even, shown to be apoptotic to breast cancer cells, which means in the presence of it, it kills breast cancer. Oh, yeah. There's a lot of literature with regards to that. You don't hear it out there as being mainstream, I think mainly because of the economics driving it. There's no money in that. There's no money in health. There's a lot of money in being sick and chronically ill. We're the most medicated modern society on Earth.
Can we talk about progesterone a little bit more? Because now that I am on the progesterone, I do feel as though my mood is a lot more even, whereas before I was on anti-anxiety medication to help me with my mood and stress levels and things like that. But the progesterone has taken its place. But it's a natural thing.
Yeah, progesterone is an amazing hormone, clearly underappreciated in medicine. You know, you never hear it talked about, but it does amazing things to women. And if you look at the highest levels of progesterone you ever have in your life, it's your third trimester pregnancy. Those levels are through the roof, sky high. And so most women, if you look at them at the end of pregnancy, they're kind of mellow. And you know, they may feel uncomfortable and stuff like that, but that mellow feeling is those high progesterone levels. And then with delivery of the baby and placenta, that level goes to 0. Well, that sudden drop puts some women into postpartum blues. If we give them progesterone, boom, you rescue every one of them. And that's not commonly known, unfortunately. But throughout life, I mean, if we want to lower anxiety levels on women, if we give you oral progesterone at bedtime, it dramatically changes it. So anxiety is a very fixable problem at the root cause in women, mostly by giving them progesterone. Plus, look at migraine headaches, all right? Women suffer far more migraine headaches than men. Why is that? There's a component related to the hormones. And a lot of times, giving a woman progesterone reduces the severity and frequency of migraine headaches.
Is there ever an age where it's too late?
Not as long as you're alive. I hear that a lot.
I love that.
I mean, I have a lot of 80-year-old women. Mm-hmm.
And that's what they're starting now.
Well,
and you're
I mean,
able to help them.
I mean, as long as you're alive, it's still helpful. You know, I mean, natural things to the body are still helpful.
Yeah, I love that. So if I had gone to a regular family doctor and they had ran my blood work, they would not have put me on the same things that you have. Is that right? They would have told me my thyroid was normal.
Well, it's because it's a perfect case that they don't know what they don't know. I mean, I didn't used to know. You know, I was a good student when I was in medical school. I did well, but I did not know these things. You don't know these things until you study, and then, you know, taking care of, you know, thousands of patients, then you learn a lot over time. I mean, and women are the most complicated because you have the most variables with regards to hormones. But when everything's good, it's amazing. You know?
And I'm having a lot better orgasms than I had before. So let's also talk about that. That is true.
Now, that's a common thing in life, you know. I mean,
I could never go back. If they decided that I couldn't get the testosterone, because I'm on a testosterone cream, full transparency, no gatekeeping. Let me just say everything that I'm on. So I take the progesterone. I take the testosterone cream every single night. I mean, that alone is a game changer just with the orgasms, really. And then I am also on, what else am I on? Do you know?
Vitamin D and DHEA.
Oh yeah,
yeah.
The vitamin D, DHEA, magnesium.
Yeah.
And those are all vitamins.
Mm-hmm. Probably some melatonin.
Yeah, I do take melatonin, but the progesterone also helps me sleep at night.
Oh, for sure. It's huge 100%. For sleep.
And that is also ties to anxiety too. If you're not getting enough rest,
Absolutely.
You can have anxiety, which is amazing that I've been able to remove any sort of anti-anxiety medication because that's not. No, I didn't feel like that was good for me.
We work hard at getting
either.
People off of their, you know, an SSRI, for example, because, you know, so much what happens in medicine is a woman's complaint is heard, but they give them, you know, what is the answer? You get an SSRI, anxiety, depression, whatever. Well, look at all the side effects associated with that, right? I mean, it oftentimes has a huge negative effect on your sexual health. I'll tell you what the biggest problem I see sometimes is, you know, I see more women than men, but the women are dialed up and they may feel better than they've ever felt in life. And then they drag in their husband. It's like, you got to fix this guy. He doesn't work.
He doesn't work.
Poor guy's like, yeah, it's like, you know, life is sort of unfair in the respect that men, we're our best early in life, right? 25, 30, 40, whatever. And life is busy, you know, everybody's busy raising family and working and blah, blah, blah. And so, you know, that intimate part of your life is kind of interrupted, right? But then later in life, when the kids are grown and everybody's got a little bit more time and, you know, it should be really good. Well, now a woman is amazing, doing better than she's ever done. And the guy, well, we're not our best, right? At 50, we're not our best. Or even 45.
Yeah, you got to catch up.
I would tell you half of the 45-year-old men I see have issues in the
What
bedroom.
kind of issues? Oh,
Some
yeah.
degree of functional issues when it comes to
My
sexual
husband,
function.
same thing. And it's not like I'm unattractive, but
No.
imagine how that makes his wife feel is if you can't even perform.
This is what I tell women that are in the boat of, right, their libido is through the roof and their husband's not. And I say, welcome to a man's world, right? And they're kind of like,
Because you feel like at a certain age it switches.
it does
or
switch.
Because
It does
they were
switch.
your patient.
When
and
you
were
when
able
you
to help them.
optimize a woman's hormones and everything like that, with all of the things, you know, being equal, their libido goes up.
So does everybody come to you and says, thank you for the amazing orgasms?
I tell you what, I get a lot of thank you cards from husbands.
Yeah.
You know, I mean, it changes a lot of marriages. You know, you've got, you know, situations where, you know, you have a woman that just, I mean, she just doesn't feel good, you know, and so like the last thing she's wanting to do is that.
Just
But-
energy level.
Well, I mean, it's like just energy. She just has no libido, right?
Yeah.
And so, you know, maybe she's consenting, but not really that actively engaged and, you know, blah, blah, blah. But when it's, you know, when it's good for both people, it's amazing, right?
Right. Yeah.
Yeah. Yeah. And it should be like that. It can be. It's achievable. Instead of just going to the doctor and just say, well, you know, you're getting older. Just, you know, hang it up.
Well, and
Play
that's
golf.
why I think my husband, when he first came home from seeing you, is that he said he wants to see you too. He likes to see couples. Is that why?
I do.
Yeah.
Yes. I do like to see couples.
And I'm like, I'm fine. Look at me. I'm
Well,
fine.
because what happens later in life is it makes a huge difference. You know what I'm saying?
Oh, I had
It
no
makes a
idea I
huge
needed
difference.
any sort of help.
Yeah.
But you couldn't
Well, you're just like making a good thing better, okay? And
optimal.
Yes.
But that's your word.
When
You like
it's-
optimal.
yes, I do.
Yes.
yes, I do.
But I would never be able to go back ever.
But I see a lot of younger women, because women talk, and I see them, and one of their main complaints is, I have no libido. It changed. They used
Yeah.
to, maybe. They just
I didn't
don't.
really have a libido.
But-
It was really, I had to really just work myself up to it to just be like, I'm going to have to do this. I don't
I've
really
seen
want
women
to.
that have never had an orgasm,
Really?
and they've been married for quite a long time. And I'm like,
I did feel like orgasms took longer to get. And now they're very quick.
good.
He doesn't have to work as hard. It's a lot easier. And they're better, and they're longer, and they're multiple, and they're all of the amazing things. It is, I mean, is this something that you hear from all of your patients?
Yes, that is.
They are
that
so
is-
good.
And it is so healthy to have that part of your life.
But I
'Cause
didn't
there's a
have
lot
that
of-
when I was like
But there's a lot of
19,
hormone
20.
things that happen with a climax too, right?
Yeah.
And those are healthy things, and we know that.
No, I'm like having a seizure. It's so good. Seriously, like a seizure. It is so good. I've never felt anything like it. Not even when I was younger, where my sex drive should have been the highest, right? And not even as good as it is now.
Well, I don't think that necessarily a younger woman always has a better libido, or because it takes a while sometimes for women to figure out their bodies and, you know, all of that sort of thing. And so I think later in life,
It also, I feel
It
like, takes
comes together. The guy.
your spouse, a
Oh,
long time
absolutely.
to figure out what makes us click, because that is
Yes.
so hard too. Because
It is.
men, you can get off no problem every time.
I know, but sometimes,
No problem.
sometimes 2 minutes, a woman needs more than 2 minutes. Okay.
Yeah,
Yeah. Sometimes that's a problem,
yeah.
but we can work on that too. No,
Yeah.
it, you know, it goes both ways, but
But now you only need 2 minutes.
Takes
if you're
two
on the
to have the magic.
testosterone cream, you only need 2 minutes. That's all you need, because it's so much quicker and harder and intense. And like I said, it is like a seizure.
It's funny, because my observation has been women that have a very active and good sex life in that respect are happier and their well-being is better.
I agree. I truly believe that our marriage has been so much better because we've been married for 22 years. You have to understand there's been a lot of struggle. You've been married more than once, so right? It takes a lot of work. There's a lot of problems. And since we have even come to you and gotten all of our hormones in line and gotten on the Flinders cocktail, our marriage has been better. I've also been a better mom. I've been a better human in general just because I'm happier in life. And I wake up every single morning and I want to have sex. I don't have to talk myself into it because it's my husband's birthday. None of those things. It's a Friday, Saturday night. I don't. I'm like every single morning like clockwork.
It's amazing.
Amazing.
Let me deviate
happy.
and tell you this story. So, as an interventional pain doctor, I deal with all sorts of problems. But one of the things we do sometimes in people that have some real severe chronic disabling pain is a thing called neuromodulation or spinal cord stimulation. So I had this woman, and she was in her mid-60s and had a bunch of spine surgery and just had really suffered, was not doing well. A lot of pain, and I put a spinal cord stimulator in her, which is a device that can block the pain sensation that's going to the brain. So instead of feeling pain, we block that. Well, once in a while, we can stimulate certain areas. Well,
you can?
Yeah. So actually, one of the programs of the spinal cord stimulator that I put in her stimulated orgasm. And it was interesting because her demeanor, now, it probably had to do because...
Did you know that it was going to happen?
No, I can't. You can't routinely do it, but I've seen it happen many times. But to say we're going to put a stimulator in and, we can always find the sweet spot.
So this happened by accident?
Yeah, by accident. So
That's
she
amazing.
ran that program
What a lucky
all
lady.
the time, right?
Yeah.
And her demeanor changed. Like she had kind of fallen out with her family and this and that. But, I'm sure some of it had to do with her pain was reduced as well. But, she ran that program a lot. And I thought it was funny.
That is funny.
It is.
I mean, that's what I would do.
It is.
It makes total sense. Yeah. That's interesting because sometimes I do feel like those orgasms are so good, they're almost painful. Like, I'm like, I want it to stop because they're so long. And I'm like, okay, please stop. Like, it's because it's gone. It's so long. Is this normal? You hear this? Like, this is a common problem. It's not really a problem, but it is. It's kind of amazing.
I've heard some interesting stories. I can tell you that.
Yeah. Do you want to share any of them?
Well, how about the woman I told you? I told you this one that had never had an orgasm. She'd been married for almost a decade, right?
Yeah.
And
has never had an orgasm?
Never had an orgasm in her life. And I said...
Ever?
I said...
Like not even from being eaten out or anything?
I said, well, what does your husband think? And she goes, oh, he doesn't know. And don't tell him. She fakes it. Yeah, she fakes it. So guess what?
I do have a friend. Maybe I know this friend because I have a friend that did that. Yes.
Well, so when everything was, dialed in and, she has them regularly.
Interesting.
So it, can definitely have an effect on those things.
By being dialed in, you're talking about...
Well, I mean, to optimize your hormones.
The hormones.
Yeah. Mm-hmm.
Hormone regulation is everything to me. I don't know how it's not part of the regular medical field. I don't know why.
There's no money in it. That's why.
But there's so much happiness in it.
I know, but that's not what
how can we fix this?
Right
is there
areas.
Anything that we can do?
It's driven by patients.
Patients.
When they
so
know
what can we do?
Well, I mean, it's patients knowing people like you, and it's like, well, I want what she has.
Yeah.
And that does drive things.
Yeah, but
the problem is at the education level of physicians is learning how to do this. There are some venues to do that.
Not all of us can go to Texas Tech, okay?
Well, I didn't learn it there, but I mean, there are ways of
continuing education.
There's definitely
is what you're
courses
saying.
to take to learn about these things. Yeah,
and because you went to a lot,
but these are not areas that are driven by big areas of primary care. The American College of Family Practice does not talk about this. Okay, It's not in their wheelhouse.
They should.
Well, remember who funds them?
Yeah.
Big Pharma, right?
Yeah.
Yeah, no, not going to happen.
Not going to happen.
It's being driven by patients more than anything, is what I see.
Is there any way to get rid of Big Pharma?
They're trying to do it to some way. I mean, but
Because our
but
doctors
they
also
own it.
kind of fed up
They
with
essentially
it.
influence everything, right?
Yeah.
Like you can't say a negative thing about something on TV because they own the advertising dollars, right?
Right.
Well, look at all the medical journals. They fund those. It just goes so deep. It goes so deep. Yeah.
Yeah. There's really nothing we can do about it.
Well, I mean, some very basic things have to happen, but
Yeah.
it's not going to happen anytime soon, I see. Because it has to happen at the grassroots level, and, we can't, those things are not even being taught. We don't have professors that know that to teach to the students, you know what I'm saying?
Yeah.
Yeah,
It's
when I
sad.
have medical students that rotate with me, I tell them all this stuff, just so they're aware of it, Otherwise, they're not aware of it. Like we have a son in medical school, and I tell him all these things. So he's keenly aware of it, but they don't really learn it, They don't know that. And, you'd think that OBGYN, that this would be their wheelhouse.
It should be.
Mostly it's not. Mostly they don't. Some do, but mostly they don't.
Especially the progesterone. You would think that
Everything
would
is
be-
synthetics,
Yeah.
Everything is synthetics. They'll give you a progestin, but that's not progesterone.
Right. Because everything that you do, everything that you prescribe are all naturally found in your body.
Yes. These are the same
Nothing
molecules.
is synthetic.
No. It's not that we don't sometimes have, say, a secreting IUD in some younger women for, various and sundry reasons, including birth control. No,
Oh,
that's
birth
fine.
control. Because you don't love birth control.
Well,
When I first came in, you had asked me, are you on any sort of antidepressants or anti-anxiety? Are you on any birth control? And I said no to all of those. And you were like, perfect. Great.
well, because now we
This is
know
easier.
because now we know where your natural self is, right? If you're on other things,
But
well,
you don't
that
love
can
those
influence it.
things.
Well, not if we can avoid it,
Yeah.
right? I mean, different points in life, people have to, do whatever you got to do. But there's a lot of different forms of birth control,
Yeah. Okay, so what would you recommend for birth control? If you have to be on it, what would you
Well, I
recommend?
mean, you've got young women, and they're not necessarily negatively affected by an oral pill. Some of them are.
Well, it
They
does
can
seem
train
like
it.
there is a lot more
Well, it changes them, right?
as far as what? Their
Well,
mental state?
if you put a woman on birth control pills, there's negative feedback to the brain that changes the release of other hormones, which affects
it
other
made
things.
me crazy.
Well, it lowers the natural testosterone level in women.
Okay.
Well, it can be an issue. That's something. It increases the risk of other things.
Is that why women's testosterone level is lower in general then?
Well, sometimes it is, but then sometimes it's elevated. We have a lot of women that have polycystic ovary syndrome or a component thereof, and so it may be elevated. I mean, elevated testosterone is not a problem in women. That's not the problem of PCOS. It's actually insulin resistance and other things. But
I'm loving my
But-
increased testosterone.
yes.
It's amazing,
yes,
as I've already said. I love that. I love that basically everything that you are working with your patients, everything is naturally found in the body. I love that. I love that you're trying to get away from everything that is synthetic. I love that. I mean, everything that you do is more natural. I think it's great. I love everything you do. I tell everybody about it. I do.
it's funny. Well, I mean, and I'm still learning a lot in the respect that just to see how things change in individuals when, you'll see all kinds of complaints of things, but you don't necessarily have a good answer for it. But if you really optimize all the natural things and diet and exercise, it's amazing what gets better. Amazing what gets better. Everything from digestive issues to, you can't imagine. I mean, things you would not necessarily connect. But just remember, every cell in the body has receptors for these hormones. And so when you turn the machinery on and everything's working just right, it fixes a lot of things.
No, it does.
Yeah.
I was pooping like every 3 days, and now I poop every single morning. And it has, I think it's the magnesium, is it?
Oh, it's helpful.
I don't know, but ever since that I've been to you, because it's not exercise, it's not diet, I haven't really changed any of those things because I did those things before I saw you. And everything is better. I mean, I poop every single morning. It was every 3 days before, and it was painful. It took a lot of work. Really. Okay, let's switch gears and let's talk about peptides. Can you tell us first what peptides are?
Well, I mean, peptides are molecules. They're protein molecules that, there's thousands of them. Peptides is a very general term, but you have to be cautious when it comes to peptides because some have been shown to be pro-oncologic, meaning they potentially could stimulate, cancer growth. A lot of peptides were brought onto the market and have been followed and initiated, and we have a lot of good studies with them. Basically, they're secretagogues to stimulate the release of human growth hormone. And, having optimal levels of human growth hormones, very, very healthy. That's the healing hormone. And, it's difficult, it's expensive to give somebody, human growth hormone. It didn't used to be, but it is now.
Why is that?
That's a good question. It's not expensive to produce. But there's a lot of things that we can do downstream to optimize the production of human growth hormone in us. I mean, just fasting, changing diet, exercising, optimizing testosterone. All of those pathways can help stimulate the release of our HGH.
Are peptides legal?
Yeah, they're legal. But, if you look what the regulatory agencies have changed things in recent years, and so they're not available through legitimate pharmacy sources very easily anymore. I think peptides they're overhyped for what you get. I mean, I think on top of the things we do already, the bang for your buck is very low.
Can you tell me the difference between semaglutide and why that is something that you can get over tirzepatide or retatrutide?
Well, they're all in the class of what we call GLP-1 agonists. But yeah, semaglutide and, some of these are available. Still some in question, but mostly we can still get them through very reliable sources.
Why do you like semaglutide?
We have the most experience with that.
Okay.
I've used it extensively since it, came out really in like 2017. And since, it's been able to be compounded for the last several years.
So you trust it?
Then, well, we have a lot of experience with it. And, with it being compounded, the cost to an individual has drastically been reduced. If you look early on, you can prescribe anything off-label as a doctor, right? But insurance companies, have really cut down on what they will actually approve to be covered under an insurance policy for a lot of those things because they're very expensive.
I want to go through the peptides and you tell me what they're for. Okay?
Well, I don't know very many of them.
BPC 157.
Well, I mean, you hear that hyped a lot, but as far as good clinical research, I haven't seen any really good studies. Most of what we have is anecdotal. And again, it's still hard to know what that's giving you more than another one. But most of them are stimulating the release of human growth hormone.
NAD plus?
Well, NAD plus, I mean, it's an essential thing in the body. I mean, it's used for everything, but many things stimulate it, The problem is that you've got a lot of companies out there that can claim anything they want. They are not regulated by anybody to prove what's in what they're giving you at all. So all of these things that are not regulated, they're under question. But you have to be careful about just, jumping on the bandwagon with whatever, somebody says is great.
Because you recommend ordering from a
well,
certain
we want
company.
we want to get things that are tested through a third party for purity.
Because most of the vitamins that you get at a pharmacy they are not regulated.
Yeah, things that do not require prescription. There's no entity that requires those companies to prove what's in the body. And as such, the quality may be very, very poor.
And because otherwise you can take a vitamin C and you don't really know if that's all vitamin C.
Right.
Like you said, it could be 80%
Right, or vitamin
not.
D is a common one. Yeah, you don't know.
What about CJC 1295?
Yeah, we have quite a bit of experience with that, and I like that one.
What does that do?
Again, it's a secretagogue, but it had some other properties that were somewhat helpful.
In
Specifically, it would help
simple
people
terms,
sleep.
What is a secretagogue?
It stimulates the release of something upstream.
Which is?
Well, in that case, human growth hormone.
Okay.
Mostly, that's what we're trying to do with peptides.
And
is
what does
increase the release of HGH.
What does increasing the human growth hormone do for the body?
The HGH is the healing hormone. It's what really helps us to heal anything. I mean, it's what helps to maintain youthfulness with regards to skin. It maintains elasticity. So it's definitely favorable to have optimal HGH levels.
So it seems as though a lot of these peptides do a lot of the same thing.
Oh, yeah. And remember, most of them, it's anecdotal. We don't have a lot of, science behind following, this and that and the other. It's mostly, there's a lot of hype with regards to them. I mean, look at how many peptides they advertise. Who even knows?
No, there is a lot.
There's a lot.
There's a
It's
lot.
a bit frightening because remember, some of them are pro-oncologic. But we have to look at, good long-term science with some of these things.
Right.
We know what human growth hormone does for us, but we don't understand, necessarily all of these peptides that we're injecting, what else might happen.
So if you're going to choose one, you want to try to choose the one that you've had the most experience with.
What I'm saying is I think a lot of times there's very little bang for your buck by being on peptides.
How do you feel about vaccines?
I mean, in general?
Yeah.
That's a big question.
Well, give me a big answer.
Well, I've received a lot of vaccines myself in life.
Okay.
If you look, I mean, I was born in the 1960s. So,
but the vaccines that you were given are not going to be the same as what I was given, and definitely not the same as what my kids would be given.
Yeah. So it's interesting if you really dig into vaccines, the testing, the evaluation, it's been very different than what we have for other drugs. But if you just follow over time, diseases that were common, that we had, say, the measles and mumps and things like that, a lot of those drastically changed way before the vaccine came out. They make a lot of claims that are unsupported by looking at the science. And then if you look at more recent, where we take large groups of children or people that were not vaccinated compared to those vaccinated, unfortunately, we see that the unvaccinated people are far healthier, less chronic disease. If you look at our children, since the mid-1980s, the chronic disease rate then compared to now, they're drastically sicker. Well, what's happened? Why, if we have the best medicine, why are our children so ill? Like 60% of our kids have chronic disease. The autism rate's going through the roof. These were not problems when I was a child. So we have to look at some very basic things. I mean, it's, when you go through medical school and residency and things, nobody talks about vaccine harm. Nobody. But it's a real entity. I mean, obviously nothing is without some risk. And, we have hundreds of studies now looking at the harm from the mRNA vaccines for COVID. As you know, it was gene therapy, and as we've critically analyzed it, unbelievably unsafe. May go down in history as the most unsafe thing we've ever done to mankind.
Wow.
And historically, when you look at vaccines that were brought on, tried, they'd have, 12 or 15 deaths. They were pulled off the market. Well, the CDC lists over 19,000 deaths in the U.S. due to the vaccine.
Are they actually tying that to the vaccine?
Oh, 100%. They tied it to it.
Because it seems as though...
And if you could look at countries that didn't vaccinate their people, and they did far better through COVID than we did. Far better.
Do you know a lot of people, or you hear about a lot of people that are just dying in their sleep that are healthy people?
Well, I have a lot of, vaccine harmed patients. I mean, if you talk to people around, I mean, everybody knows a healthy person that was harmed from the COVID vaccine. Yeah, that's well known now, and it's
Yeah.
well substantiated in science. We've got hundreds of studies out now. I mean, it can't be ignored.
But
When
it
you
does
look
seem,
at-
it
when you
does
just
seem
look
like
at-
it's getting ignored, though.
Well, but if you look at one of the very basic parameters, which is all-cause mortality, we have that listed all over time. Well, all-cause mortality didn't take a big jump during COVID, but it took a huge jump as soon as we started vaccinating, and it's still elevated. Our healthiest population is still dying at an alarming rate. That should be, everybody should be looking at that closely.
Did you get the COVID vaccine?
No.
But
But
you
I was-
weren't forced to,
Well,
being a
I mean,
doctor?
I had COVID. I had COVID before the vaccine came out, and I documented that my antibodies were present after I got COVID. So why would I take an experimental vaccine for something that I was already protected from?
Makes sense to me.
Well, it should make sense to everybody in science. I mean, we've always known the gold standard is, natural immunity.
Let's talk about stem cells and exosomes. It's just one after
That's another
another.
good topic. That's a good topic.
So, what is the difference between stem cells and exosomes, or are they the same?
So if you look at our stem cells, a stem cell by definition is a cell that has the genetic information to evolve into any tissue.
So, where did it come from?
What do you mean?
The stem cells and the exosomes.
Well, we've known about it for a long, long time, but exosomes, I mean, to understand exosomes is a term that's inclusive of what's inside of a cell, particularly a stem cell. It's got the growth proteins, but it's not a viable entity itself to grow into something, but it can stimulate the release. So
And
we
is that what you do?
Yeah,
with exosomes?
I have a lot of experience with
You don't do
exosomes.
stem cells.
No, I did all the training for, getting stem cells, and, we can get them from our bone marrow or from our fat cells and concentrate them down and give them. But it's much more expensive and involved doing that as compared to exosomes. And, the response with exosomes is amazing.
So one of our son's friends, he had a torn meniscus, and we brought him to you because they wanted to do surgery. And this happened during football season. He was a senior in high school. And if he had surgery, he was going to miss all of basketball season. And the kid was a star point guard. So for him to miss basketball season his senior year, and also wanted to be able to play at the next level. Why was exosomes not given as an option to him other than surgery? Other than from a wellness doctor like you, he went to a normal doctor and then to go to a surgeon to say, okay, we need to do surgery, but he was never given the option for exosomes for repair.
It's not the traditional path.
Well, it's not covered by insurance either, correct?
Yeah, we do traditional things, mostly in medicine. And, you have to look at who funds that, right?
Yeah.
What studies do we have? Well, who funds studies to have? And so it's just not going to happen, And unfortunately, most of the evidence we have with exosomes is anecdotal.
Well, I know personally of 3 people that you've been able to help, my husband included, because he was not able to do any squats, lunges. He had battled knee problems for a lot of years, and it just wasn't getting any better. And then you injected him, and within a week he was better, and he hasn't had any problems since.
But they are controlled by, our governing bodies to some degree, even your own stem cells. If we take them out of you, we can only minimally manipulate them before we have to put them back in. So I can't take your stem cells out and grow them in a petri dish and then put them back into you because the FDA won't allow that. Okay, you have to leave the country. You have to go to a different country to have that done. So, it's important that we do regulate some of this stuff to some degree, but in some ways, I think a lot of us think it's a bit of an overreach. So exosomes are available. We know a lot about them. We know the safety, the purity, all of that. They're
But they're
regulated through
only
FDA.
available if you have the money to pay for them.
Well,
'Cause
and it's off-label use. You realize
Yeah.
that. It's off-label use to do that.
So why couldn't it be available as an option when you go to the doctor and they give you that diagnosis that you have a torn meniscus? Why?
Well, you've got to have a lobbying entity to have it covered by an insurance, right? Yeah.
Yeah.
So these are produced by, individual labs that are, monitored, and, they follow all the rules of the FDA for purity and all that. They have to.
Mm-hmm.
But they don't have the economics to have lobbying power to, to come on to, be covered by insurance.
And surgery is not always the best option, but it's the only option that they're given.
Correct. Sometimes that's true. It's the only option that people are offered.
My nephew, same thing. He tore his meniscus.
Yes.
Right? He came to you. And then he was going to have surgery. He was going to miss wrestling. It was a really, really sad time. And he was only given the option of surgery. And he would have missed his entire season. But he came to you, and you were able to inject him. And you tell them you want them active as well, right? You don't want them taking any time off.
I don't restrict activity at all during that healing phase, because we know that the inflammatory mediators, they're actually signals, and that going on helps to promote the healing. I mean, really, the only downside is a very, very small risk of infection. I mean, if we put a needle anywhere, there's a risk of infection.
But there's a risk of infection when you have surgery.
Oh, for sure. A bigger risk.
A bigger risk.
Yeah.
Yeah. And unfortunately, unless you have, I guess, a higher economic background, I guess basically if you come from money, I don't know how else to say it, you can't get your hands on the exosomes. You can't. This kid, he couldn't have afforded it.
True. In the realm of things, it can be very expensive. In my opinion, most places that do this, they overcharge.
They do, because my sister, remember I told you that it was $7,000 for her to get it done in Utah. And so she flew up here because it was cheaper for her to fly up here and to have you do it than it was to go there.
Yeah, I just have the philosophy of, trying to keep the cost down for things.
Well,
in my opinion.
It's sometimes too expensive for most people anyways if they're not able to use their insurance.
Yeah. And
then at that amount, it's even higher. It's almost impossible for people to be able to afford that.
And unfortunately, that's a lot of times that's what happens in medicine. The treatment is what's covered by insurance, not necessarily what's best. Their treatment is determined by what's covered by insurance.
Well, what can be done? How can we get it so that insurance companies are able to cover the exosomes, so that these kids and adults can all be given that option?
It can be covered if you have an HSA, right?
What's
so
that?
Basically, if individuals, a health savings account.
Oh.
HSA is very useful, particularly for healthy people. We're very biased, really, kind of in what's covered by insurance. If people are, unhealthy, then mostly it's covered, right? If you smoke yourself to oblivion, we're happy to buy your oxygen. But if you're a healthier person and we want to do this, well, it's not covered.
What's the O shot?
Well, so the O shot is, funny you ask that.
Why are you blushing?
Well, it's sort of in the realm of regenerative, medicine, and so.
It sounds like everything is regenerative medicine that you deal with,
well,
right? You like that. You're basically helping your body produce what it's already produces. Yeah.
Yeah. So the O shot is just the term O shot is a copyrighted, an owned name. But what it is essentially is we take PRP, which we get your own blood, and we spin it down, and we take this portion of that's spun down, and we inject it. And so it contains a lot of proteins. It contains some stem cells and things like that can help regenerative all have regenerative properties.
Because the stem cells are coming from your own blood.
There's some in there, and so we take those and we inject it. The O-shot is we inject it around the clitoris and the labia and stimulate things, and it can definitely be helpful for some women.
What does it do?
Well, it promotes, it increases blood flow, sensitivity, and it can be helpful, particularly in older women.
Can it help you not pee when you're jumping on the trampoline?
Probably not.
I thought I read that, and I was really excited about it because I want to be able to do a backflip without peeing on a trampoline. That would be helpful. I would really like to also sneeze without having to cross my legs to make sure everything's
Well,
okay.
I mean, we have a lot of exercises to help promote that, but if you just look at the anatomy of a woman, and particularly a woman who's gone through childbirth and things like that, I mean, it definitely changes some of that anatomy over time. That despite anything, stress incontinence can be an issue.
We talked a lot about diet and exercise and how that prolongs our health. Can you talk a little bit more about that?
Yeah. So as far as diet goes, I mean, the sort of diet we want to have is we want to have a diet that keeps our insulin resistance low. And the best diet to do that is a very paleo type diet, or a diet that's void of processed simple carbohydrates. It's the processed foods that are mostly hard on us, particularly the simple processed carbohydrates that really drives insulin resistance. So, one of the most anti-inflammatory, paleo diets is a carnivore type diet. And, you combine that with intermittent fasting, and it's a very healthy diet, no question about it. And even a lot of the artificial sweeteners can raise insulin.
Oh, really? I didn't know that.
Yeah. So we really want to do everything to keep fasting insulin levels low.
Why
That's
does
healthy.
the artificial sugars do that?
Well, you can raise insulin levels even by thinking about it. Interesting,
I'm
right?
doing it right now.
The anticipating thinking about eating something really, sugary or something like that, and your insulin level can jump.
I did not know that.
So insulin is unbelievably powerful and not talked about enough.
And that's what you're looking at, right? As far as when you get those blood panels.
Yeah, that's one of the very
for.
key things we look at. Like, here's a perfect example. I had this young girl. The parents brought her to me. She's a 19-year-old girl, and she just keeps getting bigger and bigger. And she's over 300 pounds now. She's 19. But her fasting insulin level was in the mid-60s, terrifically high. And so what's happening is that's the switch. So all of her energy sources are going to making fat cells and stuffing them all around the body. So to fix that, you have to lower insulin. Well, we don't have a medication to do it. You have to do it by diet.
So you kind of give her a diet plan. Is that
Yeah, stay away from all carbs.
all carbs?
Yeah, avoid all carbs. You got to drive insulin down.
Well, it's also really hard sometimes to follow a diet plan.
It is.
I mean,
the cheapest, easiest food out there are simple carbohydrates. That's just the way it is.
Well, and it also seems like our society is so much more on the go. So we're just grabbing whatever we can, and that's usually not the healthiest options.
True. It takes more planning to eat that way. But if you go to the restaurant, you go to a restaurant, I'm not talking about fast food, but if you go to a restaurant, pretty much there's always things on that you can get that are within that realm. You just do some substituting. Don't get a baked potato with your steak.
Being able to use that GLP-1, the semaglutide.
It's very, very helpful that way. I've used it hundreds and hundreds of times. But the key point is they will not keep their weight off if they don't change their lifestyle. But it allows them that period of time to develop a new habit. And a few months of eating a different way, you've established that. And then their cravings change.
So that you don't necessarily have to be on it forever. You can just
no.
be on it for
No.
that.
Yeah, we don't want to be on forever. It's just for a period of time. It's a helpful thing. Mm-hmm. Basically, you're helping someone do what they're trying to do anyway, okay?
Yeah, so you're creating that new habit. Because what do they say? It's like a certain amount of days and you've established a new habit.
Yeah, by 3 or 4 months, people have a new habit. And they've developed, a new liking. Yeah. The balance of hormones is unique to every woman. And by manipulating specific hormones, we can see drastic changes in the way they feel and sleep and everything. I mean, it should seem weird that 25% of American women are on some sort of a SSRI,
Which is
like antidepressants, anti-anxiety medicines, all of those. That's crazy when you
what's
think
the
about it, right?
percentage? Did you say
25%?
25%? That is a high percentage.
Yeah, much more women than men.
I've been on it, and I hated how I felt on it, and it was really,
Well, it's
really
because
hard
we
to
don't
get off of
address
it.
the very basic problem. I mean, mostly we can manipulate your natural hormones and fix the problem. Like anxiety in women, no, mostly it's completely fixable with hormones. It's amazing when everything comes together and, people are doing well. That's really what makes me, feel good and happy.
Well, you're doing
about it.
great things. You are saving marriages one orgasm at a time, and you are making everybody look better and feel better. So thanks. And thanks for sitting back down with me today. I appreciate it.
My pleasure.
All right, Blamers, that's it for today's dose of truth with no chaser. Don't forget to hit follow so you don't miss the next episode. Remember, when life gets messy or a little too real, you can always blame it on Mel.